study and sleep. ऐसे तो नींद नहीं आएगी. So I guess we gotta study so that we can sleep. I have solved this part and I have solved 2 layers, but third layer which is the most difficult one वो मैं भूल गई हूँ. कैसे solve करना होता था इसको? Okay, ये यहाँ पे and oh, I'm going right. Or maybe not. और मैं भूल गई क्योंकि थर्ड लाइन से सॉल्व किया. Let's drink water right there and so that let's not overthink. I don't think that's good for my health. It's Genuverum. Valgum is जब तू जाता है. We have actually quite a messy room. ठीक है. I think that's a problem for another day. So what I'm thinking is let's just focus on my life and get it together, get it better. Let's focus on a body. Fracture. Open fracture classification, which I have seen in a bunch of great schools. Open fracture. तो यही है क्लासिफिकेशन ओपन फ्रैक्चर का, which is Gustilo-Anderson classification. What I'm thinking कि मेरे को इतना ही है क्या क्लासिफिकेशन ये? Fracture, define, classify, radiological patterns. Classification of fractures. I'm thinking कि दिन भर में पढ़ते हैं ऑर्थो, रात में भी नहीं पढ़ते, बहुत सैचुरेशन आ रहा है. दिन भर में I'll watch वीडियो लेक्चर, पढ़ भी लूँगी मैं जो भी है. Let's just read repeats and sleep. मेरा मेन एम अभी सोना है. So this is my sleeping pill. Causes of short stature पढ़ा था हमने. Bone age. So bone age assessment should be done in all children with short stature. Appearance of various epiphyseal centers and fusion of epiphysis with metaphysis tells about the skeletal maturity of the child. Bone age is conventionally read from radiograph of the left hand and wrist using either Tanner Whitehouse method It gives an idea as to what proportion of the adult height has been achieved by the child and what is remaining potential for the height gain. Bone age is delayed compared to chronological age in most cases. Of all the causes of short stature, exceptions to this are familial short stature, in which the bone age equals the chronological age, and precocious puberty, in which age exceeds the chronological age. In case of constitutional delay, undernutrition and systemic illness, bone age is less than the chronological age and corresponds to height age. In case of growth hormone deficiency and hypothyroidism, bone age may be lower than the height age. तो देयर इज स्पेसिफिक इटियोलॉजीज है, जैसे फैमिलियल शॉर्ट स्टेचर हो गया. द चाइल्ड इज शॉर्ट एज पर डेफिनेशन, दैट इज हाइट जो है वो लेस देन 3rd percentile है, बट इज नॉर्मल अकॉर्डिंग टू हिज ओन जेनेटिक पोटेंशियल डिटरमाइंड बाय द पेरेंट्स हाइट. दिस चिल्ड्रन शो कैच डाउन ग्रोथ बिटवीन बर्थ एंड 2 years of age, so that the height and weight come to land their target centile by the age of 2 years. Subsequently, the growth velocity remains normal throughout childhood and adolescence. The body proportion is appropriate and bone age equals the chronological age. Puberty is achieved at appropriate age and final height is within their target. And constitutional growth delay. These children are born with a normal length and weight and grow normally for the first 6 to 12 months of life. Their growth shows a deceleration so that the height and weight falls below the 3rd centiles. By 3 years of age, normal height velocity is resumed and they continue to grow just below and parallel to the 3rd centile with a normal height velocity. The onset of puberty and adolescent growth spurt is also delayed in these children, but final height is within normal limits. Bone age is lower than chronological age. Undernutrition, endocrine causes, cells cultural dysplasia, genetic syndrome, psychosocial dwarfism. अरे बाप रे, टर्नर सिंड्रोम में होता है डॉर्फिज्म. गर्ल्स इमोशनल deprivation dwarfism, maternal deprivation dwarfism, or hyperphagic short stature. Children in unhappy homes where emotional needs of the child are totally neglected. It is characterized by functional hypopituitarism indicated by low IGF levels and inadequate response to growth hormone to stimulation. Therapy with growth hormone is, however, not beneficial. Good catch-up growth is seen when the child is placed in a less stressful environment, and the child should be nurtured with love and affection. Then children born small for gestation age, birth weight below 10 centiles for gestation age can be caused by maternal, placental, fetal factors. Most of these infants show catch-up growth by 2 years of age. However, an estimated there is 20 to 30% of babies born SGA fails to show catch-up growth and remain short. Subtle defects in the growth hormone and insulin-like growth factors. तो मैनेजमेंट क्या है, जनरल प्रिंसिपल्स ऑफ मैनेजमेंट फॉर एनी चाइल्ड प्रेजेंट्स विद शॉर्ट स्टेज इंक्लूड. सबसे पहले तो कि काउंसलिंग ऑफ पेरेंट्स करना है, डायरेक्टली एडवाइस देना है. Parents should be counseled to highlight the positive aspects in child's personality and not to put undue emphasis on stature. Intake of balanced diet containing recommended amounts of micro and micronutrient is recommended. The specific management depends on the underlying cause. For physiological causes, reassurance and annual monitoring of height and weight is sufficient. Dietary rehabilitation for undernutrition and treatment of underlying conditions such as renal tubular acidosis or celiac diseases are associated with satisfactory catch-up growth. With any form of therapy, monitoring with regular and accurate recording of height is mandatory for satisfactory outcome. For skeletal dysplasias, limb lengthening procedures are offered at a few orthopedic centers. For hypothyroidism, levothyroxine therapy ले सकते हैं. Replacement is advised. For growth hormone deficiency, treatment with daily subcutaneous injection of growth hormone is recommended. Growth hormone therapy is also approved for several other conditions, though the doses required are generally higher and improvement in final height smaller and more variable as compared to growth hormone deficiency. Some of these conditions are Turner syndrome, SGA with inadequate catch-up growth, and chronic renal failure prior to transplant. Then there is failure to thrive, which is an important question. So failure to thrive, it is a descriptive term rather than diagnosis. It is used in infants and children up to 5 years of age whose physical growth is significantly less than their peers who are of the same age and sex. Failure to thrive usually refers to weight below 3rd or 5th centile, failure to gain weight over a period of time, or change in rate of growth that has crossed 2 major centiles, that is the 75th and 50th. Over a period of time. The prevalence of failure to thrive varies according to the population sample. Etiology is traditionally failure to thrive is classified as organic, where the child has some known underlying medical condition, and non-organic or psychosocial, where poor growth is the result of inadequate calorie provision or emotional deprivation. Organic and non-organic etiological factor, they may coexist in children with cerebral palsy or multiple congenital anomalies. Failure to thrive is non-organic in up to 80% of the cases. And causes of failure to thrive है. So failure to thrive क्या होता है कि इसमें जो infants है या फिर children है up to 5 years of the age, physical growth is significantly less as compared to their peers who are of the same age and same sex हो रहा है. Weight below 3rd या फिर 5th centiles में होता है. ठीक है, so weight below 3rd या फिर 5th centiles होना चाहिए, और failure to gain weight over a period of time. Failure to gain weight over a period of time. ठीक है. कॉजेस में अब गैस्ट्रोइंटेस्टाइनल हो सकता है, जिसमें कि गैस्ट्रोईसोफेजियल रिफ्लक्स. तो गैस्ट्रोईसोफेजियल रिफ्लक्स डिसीज है, माल एब्जॉर्प्शन है, malabsorption, inflammatory bowel disease, pyloric stenosis, neurological में mental retardation है, cerebral palsy है, renal में renal tubular acidosis है, chronic kidney disease, cardiopulmonary में congenital heart disease, cystic fibrosis, asthma, endocrine में hypothyroidism है, diabetes mellitus है, infections में chronic parasitic infections of GI tract, tuberculosis, human immunodeficiency virus, genetic में inborn errors of metabolism, chromosomal anomalies है, miscellaneous में lead poisoning या फिर malignancy, फिर non-organic में poverty, misperception और lack of knowledge about diet and feeding, lack of breastfeeding, feeding diluted formula, dysfunctional parent-child relationship की वजह से भी जो है वो हो सकता है. फिर clinical features क्या क्या है कि first is the children present with poor growth, which is often associated with poor development and cognitive functioning. The degree of failure to The degree of failure to thrive is usually measured by calculating weight and height, and weight for height as a percentage of median value for age based on appropriate growth charts. History, physical examination, and observation of parent-child interaction are important. Detailed lab investigations are needed. Only if history and physical examination suggest that an organic cause is responsible to FTD, and to localize the system which is involved. For initial evaluation, the following investigations are adequate. That is complete blood count with ESR. Renal and liver function test है, serum electrolyte, weight gain in response to adequate calorie feeding, establish the diagnosis of psychosocial FTD. ट्रीटमेंट नहीं है क्या? Okay, so पढ़ लेते हैं ग्रोथ वाला चैप्टर, फिर देखेंगे क्या लिखना है इसमें से जो इम्पोर्टेंट है. ठीक है, पढ़ लेते हैं. तो देन देयर इज मैक्रोसिफेली. तो मैक्रोसिफेली क्या होता है? एबनॉर्मलिटीज ऑफ occipital circumference greater than 2 standard deviation above the mean age and sex. Megaencephaly or enlargement of brain parenchyma may be familial or associated with inherited syndromes or neurometabolic disease. Infants with benign familial megaencephaly have increased head size at birth that persists through infancy along the upper growth curve percentiles and is associated with normal body size, neurological examination and development. Children with metabolic causes have normal head circumference at birth. Microcephaly is noted as the child gets older. Diagnosis is suggested by accompanying features and biochemical abnormalities. Hydrocephalus is characterized by excessive amount of CSF, which may be caused by increased production or decreased absorption or obstruction to the CSF flow. Most patients show postnatal rapid increase in head size and are symptomatic due to underlying disease or raised intracranial pressure, nausea, vomiting, irritability. Benign enlargement of the subarachnoid space is relatively common and is characterized by head growth velocity that slows to normal by 6 months of age, and development assessment and neurological examination are normal. Evaluation for microcephaly is indicated if health circumference is above 3 standard deviation for mean of age and sex. Causes of macrocephaly, and then there is causes of microcephaly. काफ़ी सारी कॉजेज हैं वैसे तो देखा जाए. Benign when serial measurement relief, progressive enlargement. न्यूरोफाइब्रोमाटोसिस, ल्यूकोडिस्ट्रॉफीज है, लाइसोसोमल स्टोरेज डिसऑर्डर, Tay-Sachs डिसीज, सोटोज डिसीज, फ्रेजाइल एक्स सिंड्रोम, ये बिनाइन फैमिलियल है. इंक्रीज CSF is hydrocephalus, benign enlargement of subarachnoid space, choroid plexus papilloma, enlarged vascular compartment is subdural, epidural, subarachnoid, intraventricular hemorrhage, increase in bony compartment में, bone diseases में achondroplasia, osteogenesis imperfecta, osteopetrosis है, क्लीडोक्रेनियल डिस्टोसिस, बोन मैरो एक्सपांशन है, मिसलेनियस में इंट्राक्रेनियल मास लीजन, सिस्ट, एब्सेस या ट्यूमर हो सकता है, रेज्ड इंट्राक्रेनियल प्रेशर, लेड पॉइजनिंग में भी. ओके. चिल्ड्रन विद एसिम्प्टोमेटिक familial megaencephaly. न्यूरोसर्जिकल इंटरवेंशन. तो माइक्रोसेफेली इज डिफाइंड एज occipital circumference more than 3 standard deviation below the mean for age, sex and gestation. Defining microcephaly for more than 3 standard deviation below the mean is more likely to be associated with genetic and non-genetic disorders affecting brain than if they find more than 2 standard deviation below mean, since the latter include intellectually normal healthy children with head circumference at the lower end of population distribution. The term primary microcephaly is used to describe conditions associated with reduced generation of neurons during neural development and migration. Secondary microcephaly, it follows injury or insult to the previously normal brain, causing reduction in number of dendritic process synaptic connections. Microcephaly is a term used for abnormally small brain based on finding of neuroimaging and neuropathology. Since head growth is driven by brain growth, microcephaly usually implies microencephaly except in craniocentric. Isolated inherited microcephaly, most commonly as an autosomal recessive phenotype, is associated with reduced head circumference since birth, normal cerebral anatomy, absence of neurological signs, or without learning difficulties. Other associations include structural brain malformation, inherited syndromes, congenital or acquired infections, Then there is hypoxemic ischemic insults and rare metabolic disorders. Evaluation for microcephaly should be initiated if a single head circumference measurement is more than 2 to 3 SD. Um, Autosomal recessive, autosomal dominant, X-linked, Angelman syndrome, phenylketonuria, maternal meningitis mellitus, untreated phenylketonuria, infections में cytomegalovirus, HSV, rubella, varicella, toxoplasmosis, HIV, syphilis, meningitis, teratogen, alcohol, tobacco, marijuana, cocaine, heroin, anti-epileptic drugs, radiation, perinatal insult, hypoxic ischemic encephalopathy, hypoglycemia, hypothyroidism, hypopituitarism, adrenal insufficiency. Then there is cyanostosis. It is the premature fusion of one or more cranial sutures, either major or minor. Premature fusion of one or more cranial sutures, major or minor. Cranial sutures normally fuse during early childhood, stating with metopic suture और sagittal coronal lamboid. Premature fusion जो है वो restrict कर देता है growth of the skull perpendicular to the affected suture. Compensatory skull growth occurs parallel to the affected sutures in order to accommodate the growing brain. Growth वाला chapter is done. Bharani में there is only microcephaly is given, but now both micro and macrocephaly are important. Even और मैरो में मैंने देखा है less than standard deviation. The occipitofrontal circumference more than 3 standard deviation below the mean for zone 8, 6 intersection. तो इसमें माइक्रोसेफाली मैक्रोसेफाली फेलियर टू थ्राइव लिखना है. और तो कुछ नहीं. फैक्टर्स अफेक्टिंग ग्रोथ. फीटल ग्रोथ, फीटल हॉर्मोन्स है, प्लासेंटल फैक्टर्स है, मैटरनल फैक्टर्स है, न्यूट्रिशन, अल्कोहल, ऑब्स्टेटिक कॉम्प्लिकेशंस अफेक्ट करता है, सोशल फैक्टर्स है, क्लाइमेट, इमोशनल फैक्टर्स, कल्चरल फैक्टर्स, फैमिली एजुकेशन, ठीक है। तो इसमें बस 3 चीज़ें करते हैं। एंड देन डेवलपमेंट में क्या है, could have gone the easy way कि मैरो पढ़ के निकालो। नॉर्मल मोटर डेवलपमेंट इन फर्स्ट ईयर ऑफ लाइफ। आई कैन गो मच ईजियर वे, बट वो सिर्फ पास होने के तरीके हो सकते हैं। यू नो व्हाट, मेरे को मेरा कमरा साफ करना है, मुझे कमरा साफ करना है। इट्स वेरी ग्लिच हो गया है सब। कमरा, विल क्लीन द रूम फर्स्ट, देन विल प्रोसीड इन लाइफ। क्लीन रखते हैं सराउंडिंग को। खाली
आम्ही केलंच नाही का श्रेया सोसायटी हे करत बसले. त्याचा बर्थडे आहे ना तर तिथे गेम मध्ये
कधी आहे?
1 पर त्याच्या एक्झामच्या दिवशी.
शेट प्रिलिम्स ना, आणि प्रिलिम्सचे कंटिन्युअस आहे।
तेच तर.
आधी सेलिब्रेट करा म्हणा,
हा त्यानंतर करूया आता.
नंतर
आता अभ्यास करत असेल.
कधी संपणार आहे?
दोघांना माहिती आहे.
झाली का घेऊन?
मी साक्षी प्रवाची घेऊन आली. मी सिरीज लावतो म्हणजे.
कोणती बघते?
ते अधिक वेदम तुला काल म्हटलं ना ती माझी कमी म्हणजे थोडी झाली होती.
खतरनाक
नाही छान आहे. म्हणजे असं ते वेद आहे ना, आपले 4 वेद आहेत ना, तर ते 5th वेद शोधत असतात. तसं वर्डच आहे. पण भारी आहे.
रूमला किती साफ केलं तर साफ का होत नाही? कपड्यांचं गर्दा.
तुला सांगा मी सगळं हे केलं होतं पण सेमच वाटायचं. त्यावेळेस मी माझं कबड आवडलं आतमधलं सगळं हे करून घेतलं होतं.
आज तुला लेट नाही ना झालं
नाही
पोस्टिंगला? अरे मी केस धुत होते, मला वेळ लागला आज.
बरं वाटलं ते पण मी पाहिल्यानंतर अटेंडन्सच नाही देत. म्हणलं होतं पण मी अगोदर ते करणार आधी तुला जास्त झालं असतं तो. पण मग
कोवट पण होता ना काल?
त्याने तुला स्टेपला दिलं का?
माझ्याकडे आले पाहिजे.
हां दे मग.
काय करायचं?
थँक्यू.
ठीक आहे ना. ओ मला माझा फेविकॉल भेटला काल. मी इतकं शोधलं, भेटलंच नाही मला.
तुम्ही केली लॉकबुक सगळी?
चेक करून घेतली आज मॅमकडून, एच मॅमकडून. करेक्शन सांगत बसले यार. ते तर माहिती आहे मॅम मस्त थोडे बिझीच होते, थोडी आहे ना ते. तर मग म्हणले की मी एक रेसिडेंटचं हे करते. त्यांना ओटी मधून बोलवलं रेसिडेंटला आणि म्हणलं चेक करायची लॉकबुक आणि करेक्शन सांगायला. तर ती एक एक वर्ड मग वाचत बसली आणि मग सांगत होते करेक्शन. मग साक्षीच्या ह्याच्यात सांगितलं आणि मग ते एक सर होते रेसिडेंट, ते म्हणले थोडे जण इथे आम्ही गेले, हे पटपट साईन देणार आहे. ते फिमेल रेसिडेंट खूप टाईम लावतात द्यायला. सर लोक विचारतात हा लिहिलंय ना, हा सर लिहिलंय, देतात साईन लगेच. चांगले असतात यार.
खतरनाक असलं तर ते तुम्हाला चांगलं.
साक्षीने का हे तर जास्त काय आहे हे
खूप आहे.
इतकं भरलेलं का दिसतं मला.
भरलेलं ते भारी केलं. जास्त आहे खरंच तर थोडा वेळ लागला असेल.
हम्म.
Thank you.